Welcome to another edition of Mental Health Moments. We'll share mental health news and information we hope will empower you and your family to get on or stay on a journey towards wellness, mind, body, spirit, and soul. In coordination with the Centers for Disease Control, the CDC, the City of District Heights, the Maryland Center at Bowie State University, and the Youth Services Bureau will begin running public service announcements to help reduce or eliminate smoking in our communities. Here's a sample PSA bringing awareness to secondhand smoke.
I quit smoking, but I still get those cravings. So I talked to my doctor, and with counseling, exercise, and using the nicotine patch and gum, I quit for good. My tip is, get help to find the best way for you to quit smoking.
Before you have to replace your voice box.
You can quit. For free help, call 1-800-QUIT-NOW.
My son Aiden has asthma. Secondhand smoke has triggered his asthma so bad to the point where he had to end up in the emergency room. And he has spent multiple nights in intensive care. Now he's on a whole bunch of medications. My tip to you is, don't be shy to tell people not to smoke around your kids.
For free help, visit cdc.gov/tips.
I believe no one wants this for their child. Thanks to efforts by the City of District Heights, the Maryland Center, and our staff, we can all stand ready to help you quit, no matter your age. Call the YSB for more information. Take the steps to quit now. Well, let's get started. Come out to the Recreation Department on May 18th to learn more about the Maryland Coalition of Families Youth Advisory Council. Come ready to participate in Open Mic Night. The event begins at 6 p.m. The Maryland Coalition of Families Youth Advisory Council meets in the Recreation Department on the third Friday of every month. A YSB clinician shares healthful information with youth as they plan programs and events designed to assist their peers with struggles or stressors that could derail their progress. Open Mic Night is one such program. While the program is designed for and by youth, support from all ages, making this a family initiative, is a must. If you believe your teen is ready to help or be helped, call us to find out more about the program. Speaking of family initiatives, the City of District Heights, the Youth Services Bureau, and the Youth Development Foundation wants to partner with you to host its first Family Health Fair with men in mind. The health fair is June 30th and will be hosted here in the city from 9 a.m. to 3 p.m. There'll be representatives here from numerous healthcare organizations to include the Prince George's County Health Connect. Come get your questions answered about health insurance, and if you haven't already, come here to enroll. If you're interested in giving blood, tasting healthy foods, talking to a doctor, or becoming more job savvy, prepare now to attend. Blood donors are asked to pre-register. Come get a medical massage, try yoga with your entire family, get a free fitness evaluation with a professional trainer. Also, if you'd like to assist us in the planning or participate as a vendor, call us as soon as possible. 301-336-7600. This year, the YSB will host a 3-week summer camp called Creative Minds. The camp begins August 13th and runs through August 31st. We only have 10 slots, so stop by to sign up as soon as possible. Aftercare will also be offered. This camp will be facilitated by licensed and license-eligible counselors and counselor interns. Campers will be encouraged to participate in the expressive arts from dance to drama, ending with a summer camp musical called From Hurt to Hope, Trials to Triumphs. Call the office for more information. Stay tuned for future mental health moments where we'll discuss our new DUI education plan, our new building located at 6421 Atwood Street, and more information about how we want to serve you. Know that your mental health is just as important as your physical health. Ignore the stigma and let us serve you and your family. If your child, teen, or family could use a little help finding harmony or balance along the journey, or if you'd like to partner with us in service, call us. And remember, children's mental health matters. May is Children's Mental Health Matters Awareness Month. 20 to 25% of children suffer from a severe mental illness. Parents and guardians, don't miss the signs of mental health issues. How do you know if your child needs counseling? In many cases, an initial assessment or consultation only costs your time, and your child's mental health is certainly worth your effort. Have your child assessed by a mental behavioral health clinician. Don't wait. Let us help you to help your family become the healthy, happy family you want it to be. Listen as Dr. Beth Crawford, licensed clinical psychologist in Maryland and DC, discusses the issues of children's mental health. Dr. Crawford is also the Chief Executive Officer of Maryland Family Resource Incorporated, an outpatient behavioral health agency in Landover, serving children, adolescents, and adults. Remember, children's mental health matters.
There's still a significant amount of stigma in this community about mental health services. And so although over my time here, I've been here for 20 years, and when I first started here, the stigma was significant. It was a barrier, a significant barrier to treatment. I've seen that really improve over the years. I'm really excited about that, but there's still a lot of work to do in terms of making it okay to seek mental health treatment. And so that's why we got involved with this campaign. I do want to give a big shout out to the Mental Health Association of Maryland, and also to the Maryland Coalition of Families and our Behavioral Health Association for taking this on, organizing and coordinating it, and getting us together to do such powerful work. I've seen mostly positive changes over the years. I think that we're moving away from traditional therapies that have lost people or that have gone on for months and months or years and years in some cases, leaving families wondering, did it really help? Is my child really better? I think now there's much more of a focus on accountability for practitioners around results. We're looking at outcomes more closely and trying to determine if we're choosing and using treatments that are really helping children. And that's really exciting. And so there's lots more training, and there's a big movement toward using evidence-based practices where there is literature and research to support the outcomes that we can have for children. And I think this is really helpful and motivating because families, can know that there's research behind a lot of these interventions and that they truly can be effective. Some of them are short-term interventions, which I think are more attractive to families that are a little bit hesitant about committing to mental health services. Like our trauma-focused cognitive behavioral therapy program is like a 12-week model to address childhood trauma. And I think when people find out you're not signing up for forever, and when does this end, and how do we know we're better and we're ready to move on, I think the therapies now have shifted to being more time-limited, solution-focused, goal-oriented, and looking at outcomes. The message that I really would like to say to any caretaker, like you said, like a grandparent, a parent, an aunt, older sister, is the time is now. Our children need help now. 1 in 4 children suffer from a mental health diagnosis. Many of them have not sought services and have not been helped. These things don't go away. And I think childhood is a ripe opportunity to intervene before, kids continue to grow and get used to maladaptive coping strategies and so forth. A lot of times when we begin to try to intervene when people are adults, lots more things have occurred. And, it's sometimes the road is a little bit more difficult to go all the way back to childhood and fix things, so sometimes instead of just having some depression to deal with, now you've had, maybe, more difficult situations for the person, like substance abuse issues, and a lot of things have kind of piled up on the person. And while, we're hopeful and we do a lot of great adult work in this community as well, and that it's never too late to get help, I think that we should really take advantage of the opportunity to recognize when our children need help. And I do know that that's difficult sometimes because, like on the Children's Mental Health Matters website, it says it's easy to know when your child has a fever or a flu or a broken bone, and you need to take them to get help. When your child has a mental health issue, sometimes it's much more difficult to identify that something's going wrong, especially with all the developmental stages that children go through. What is my child really supposed to look like? But if you have a question or a concern, trust your gut and get help. The time is now for children's mental health.